and we'll come back. We spoke at the beginning, what are the different skin conditions, skin problems that you see in the pharmacy, at your pharmacy. We talked about pigmentation and how we can help improve the quality of life when it comes to pigmentation. What's the second most common skin problem that you see? One of what do you see during your day is dry skin. And when it comes to skin dryness, what's the objective? What's our objective in treating dryness?
Hydrating the skin.
Hydrating the skin.
Without
over-hydrating.
yes.
Without leaving a sticky texture or sticky feeling on the skin. A white cast. So my objective is to give hydration, right? If I want to give hydration, how can I give hydration? What shall I use? Hyaluronic acid. Hyaluronic acid, how it works, it grabs water. So it traps the water inside, so it gives more hydration. Hyaluronic acid is a solution. What? Panthenol, glycerin, liquid, paraffin. Vitamin E, it can give, if the formula has vitamin E inside. So we are talking about actives that gives hydration in a specific way. Either they attract water or they work as soothing and anti-inflammatory, so it calms the itchiness. By this, my skin will feel hydrated, right? But what's the problem of skin hydration? First of all, we see different types of dryness. Either it is mild, not types, but either it is mild, moderate, or severe, correct? And in each type, we recommend specific actives, right? If we look at the dryness and we see what's the impact of skin dryness on the skin, you will see that we have, this is the skin, this is a healthy skin. Here are the cells, keratinocytes, and here we have the cement between the cells, and healthy skin look like that, right? It has healthy ceramides level that are connecting all the cells together. So there is no loss of water. The transepidermal water loss is not high, right? Whereas this is dry skin, disrupted skin. The barriers, the cells are not well organized, right? And the barriers are disrupted. So if I applied hyaluronic acid, glycerin, shea butter, panthenol, what will happen? The transepidermal water will reduce, right? But will I repair the barriers? How can I repair the skin barrier? First of all, the cement one, is made up of ceramide. And we have so many different ceramides. But as per the studies and all the research that have been done to understand what are the ceramides that are responsible for skin dryness, they discovered 3. We call it EOP, NP, and AP. We have these 3 essential ceramides that whenever they are disrupted, you can see this alteration. The skin is very dry. So it's very important to apply hyaluronic acid, shea butter, glycerin. This is important. Yeah. But what else? How can I improve? Urea is something. What else I can add to the formula to restore this? I need to, objective and dryness, first of all, to feel this relief. My skin is very, very well hydrated and moisturized. But also the other objective is to return the skin back to normal. How? If the ceramides in a dry skin are disrupted, how can I return it back to normal? What shall I add to the formula? Ceramides. And the 3 ceramides that are responsible, that are altered, right? So that's why when they launched CeraVe, coming from the mindset of restoring, not only just hydrating, you can look at the formula, you will see that it has 2 things. First of all, the 3 ceramides that I already mentioned, wholly 3 ceramides are responsible for skin dryness, the EOP, NP, and the AP. Whenever they are disrupted, this means that my skin barriers are not restored, so I will start to feel dryness, itchiness, and etc. The second thing, I need my patient to be compliant. right? Either on if they are taking any adjunctive treatment, if the dryness is very severe. Also, what I need to give them a solution that gives a hydration for a longer period of time. No one will reapply body moisturizer every single 2 hours, correct? Any one of you will do this? So you look at something that has long-lasting efficacy. That's why in CeraVe, it's not only the formula, it's also the technology. So the technology is very important. It is MVE, multivascular emulsion technology, and as you can see here in the figure, there is an instant release of the molecules, of the ingredients during the day. This will ensure long-lasting hydration effect. Make sense to you? So now if we look at the formula of the moisturizing cream, you can see that it has hyaluronic acid because it's very important to retain water. It has glycerine because it helps in hydrating the skin. Also, it has the ceramide because our objective when it comes to dryness is not only to hydrate but also to restore. So in all CeraVe range, you will see whatever is it moisturizer, lotion, cleanser, you will see ceramides, because this is essential to repair our skin barrier. It comes in a cream and in a lotion. The only difference is it's one cream, one lotion based on patient preferences. Some prefer to apply cream, others they prefer to apply lotion. Okay, we have a very important population, the elderly people, the diabetic. They are taking so many medications, diuretics maybe. And the skin condition is very, very dry. It's no longer mild, no longer moderate. It's becoming severe. Do you think it is enough to use ceramide, hyaluronic acid, and glycerin? I need to add something extra to the formula to help them have better hydration. So what's, in your opinion, I can add to make the moisturizing effect the best journey to them? I'm giving everything to them. You just mentioned earlier, urea. Because urea helps in hydrating the skin and soothing the skin. Yeah. Okay, so here I'm giving high hydration. I'm restoring the moisture. I'm maintaining the moisture of the skin, and I'm restoring and repairing the barrier. That's why we introduced for this category of patients the intensive moisturizing lotion that has inside 5% urea. Okay, so now. Excuse me. New. Yeah. Yes. It has 5% hydroxyurea to be very specific in it, not the urea. Okay? So in this way, we have solutions, whether the skin dryness is mild, moderate, or if it is severe. Whether the patients are, it's a mild dryness, or if they are taking any medications for psoriasis, xerosis. Why? Because we said at the beginning, we need to always think adjunctive therapy. How can I make the client has better quality of life, and how can make my patient compliant to the initial treatment? So if you received any prescription that has inside any medication that might cause skin dryness, or it's a treatment for psoriasis or xerosis, always keep in your mind that it's your role to recommend and advise them what is the appropriate moisturizer that they can use. Agree? So once we talk about CeraVe, we talk atopic dermatitis. And also once we talk about CeraVe, what it comes to your mind? What other than the moisturizing creams, lotions? They have something that's very specific to them, and repair cream. Eye repair cream. CeraVe, they are very well known in two things. These two things. Cleansers and the moisturizers. So when it comes to cleansers, always keep in your mind what's the ingredients inside. Whatever is the cleanser, ceramides. So ceramides plus actives. The basic is always ceramides plus active. Yes, I will talk about it. So whatever is, if it's hydrating cleanser, foaming cleanser, or for a specific category, the acne one, I forgot something. Before I move to the cleanser, I want to show you the studies that have been done on the efficacy of the IML. I said in the beginning that it's important to see fast result, right? Yeah. And the patient will not reapply moisturizing cream or the lotion every single 2 hours. So they need something lasting. As per the studies that have been done on CeraVe moisturizing IML, you can see that the onset within 8 hours, 71% increase in hydration after 8 hours, but from 0 they start to see improvement, and it lasts for 72 hours. But definitely we will advise them to apply it every single day, not to wait 3 days, because they will shower and they will, which this is very important, especially if the dryness is severe. It becomes too itchy. I need immediate relief, as well as 100% reduction of itchiness starting week 1, which is also very important, in specific if they are on other medications and if the dryness is very severe, within 1 week. Yes. So now, going back to the cleansers, what they have something specific for acne, and once we speak about acne, definitely we are looking to something that has actives inside. What are the actives that you would love to see in an acne product? Salicylic acid. If it has alpha and beta hydroxy acid, it will be amazing, because we are working on 2 things: on controlling the acne, the sebum secretion, controlling the oiliness, and as well as exfoliating. And what do you expect also to be inside the product? Since it is CeraVe, moisturizing. Huh? Ceramides, exactly, because we are thinking about restoring. And the skin barrier, if we are suffering from acne, definitely our skin barrier is ruptured and it's not restored. So I need to restore it. It comes with cleanser and face cream, blemish control gel. So you have the cleanser having purifying clay, niacinamide. I need niacinamide as anti-inflammatory, salicylic acid and hyaluronic acid, definitely with ceramide to repair. You cleanse it twice. Okay, and the blemish control gel that has alpha hydroxy acid, niacinamide with ceramide and salicylic acid, and we apply it at night. For blemishes, that's black, white heads, mild, oily skin type, acne prone skin that they need something to always keep the oiliness controlled, you can recommend blemish control every single night and the cleanser twice daily. As per the studies that have been done on the skin regimen, blemish control cleanser with the gel, you can see 41% increase in the size and the inflammation, the size of the acne itself and the inflammation, okay? So if it's big in size, it will shrink because of the exfoliation of effect alpha and beta hydroxy acid. You can use it definitely daily. Yes? No, it has ceramides. Yeah. It has hyaluronic acid. Yeah, I know. So, and niacinamide. So you can use it every single day. If you need an extra moisturizer, you have the moisturizing hydrating cream.
Yes. But it has the moisturizer inside. Like
yes, I know, but if at night, once daily at night.
Because of the
any questions for CeraVe? Have you ever used it? Do you have any feedback? Have you ever received like any prescription that you thought you want to add a moisturizer to? Okay, interesting.
It's if you're having like dry skin.
Okay. Did you hear any feedback? What acne? The acne.
Facial.
Okay.
Facial cleansers.
The cleansers. Okay. It is sealed inside. Okay, we can. They think it's already open. But whenever you open it, like you feel it's homogeneous. It's not like the face, how the cream looks. It's not like
Straight.
yes, straight. It's not like
you just come back and it's not sealed. They are telling to me like that.
Okay. We can.
But the Cetaphil, doctor, it's like something with the sticker, like sealed sticker.
Okay. If they think your clients are like they don't like this and they will decide whether to take the cream, you can recommend the lotion.
The pump.
The pump, if they feel like. At the end of the day, we don't want to lose the benefits of CeraVe just because of the cover. Okay, so we covered everything related to CeraVe, not only for atopic dermatitis. Now, the other problem that we see, other than acne, I know like acne is very common and we tackled it with CeraVe, but there is another condition that you see it and we see it frequently. What do you think it is related to body, to us? Not body, not face. What do you think it is? What are you saying, huh? Dandruff. And when it comes to dandruff, what can you tell me about dandruff? Ceramide. What's the difference in CeraVe? What CeraVe has inside? It is MVE technology. It is ceramides. And once we talk about ceramide, it's very important to always keep in your mind what are the ceramides inside the formula. It's not only ceramide and MVE technology, it's the formula behind it. It has hyaluronic acid, glycerin, shea butter. It's support. We have so many data that prove the efficacy of the product. But it's, if they have, like you will tell me Cetaphil, they have also ceramides inside. But what about the technology? We said something very important. The product that I'm marketing or I'm explaining to you, the ingredients are the best ingredients. But what it lacks is the compliance. Who will apply body moisturizer every 3 or 6 hours? Will you do it?
No, nobody.
So nobody will do it. So what you can tell your client that this CeraVe, I'm 100% sure and confident that it will give you hydration for 72 hours from one single application. This to ensure for the coming 24 hours this day, your skin is hydrated, okay? So by this way, you will start to explain that CeraVe, they have the ceramides. Tell the patient, what are the ceramides? Once we have skin dryness, there is a specific cement, specific agent that makes our cells close together to prevent water loss. So whenever we have dryness, those ceramides, we lose them. They are disrupted. So CeraVe will replace them. This is one. 2, in order to give you the maximum hydration and not to reapply again, from one single application, your skin is very well hydrated. And there is a relief after 1 week from all the itchiness, the itchy feeling. Does it make sense to you now if you want to compare this to that?
Yes.
Focusing on the technology, هو اللي هيقلك هيدا also I use Cetaphil and the skin hydrated. But if you will tell them that the technology here, every single hour there is a release of the ingredient. So every single every single time the time passes, there is a release of ceramides, glycerin, hyaluronic acid all together to the skin. So I'm not just hydrating, I'm restoring and repairing because of the technology and the actives. Restoring and repairing. Let the patient get used to hearing the word restoring, repairing. So they will come back to you that you are not just, I can go to Sephora and buy moisturizer, to Body Shop and buy moisturizer.
Exactly.
They smell good. The texture is okay. But they are just giving me hydration. But I need something to restore and repair, solution. So let them get used to, no, I'm not recommending, I'm giving you a restoring cream, a repairing cream. Okay? So to go back to dandruff, any questions related to CeraVe? Okay. Going back to dandruff, if you want to talk about dandruff, what can you tell me about dandruff? Anything that comes to your mind. White flakes, maybe. Itchy. Hair loss. Very nice. Oily scalp. Sensitive.
Uncomfortable feeling.
Uncomfortable feeling. And uncomfortable feeling that the patients, they are looking, thank you. Uncomfortable feeling and the patients, what they are looking for, an immediate result, immediate relief. I cannot go outside even if I showered and I have white flakes and it's itchy, right? Yeah. If we want to look about why we have dandruff and what's the reason for dandruff, first of all, 50% of the population, they are suffering from dandruff, whether it is seborrheic dermatitis or dandruff, the white one. And it is the number 2 most skin problem that we can see, and it impacts the quality of life of every single one, right? It comes either in as dandruff or seborrheic dermatitis, the most severe one, severe case. And if you look at the pathogenetic cycle of dandruff and why I do have it, it's a 3 main problems and it's a cycle, correct? It's a cycle that starts with what? Fungal. How do I treat fungal? What do I recommend? Ketoconazole, antifungal, right? Why? To kill the fungus, right? The point is, there is an imbalance in the microbiome. The fungus, it's something normal that we have it on our scalp. But what happens whenever we are having any external factor, this fungus becomes 10 times more than its level. So the objective here is to return it back to its normal level. So I need to rebalance it, correct? So whenever it is balanced, see what will happen. The sebum composition will return back to normal, and the barriers of our scalp will return back to normal. So for me to have a product that treats dandruff, I have to respect this cycle, right? Either I recommend antifungal, so here I'm killing the fungus, so the numbers will decrease. But what's the problem whenever I stop the treatment?
Come back.
It will come back. Why? Because I didn't return it back to its normal level. I just killed some of the fungus. And I didn't treat the sebum, and I didn't heal the scalp, the barrier of the scalp. I just killed the fungus, correct? So when it comes to treatment, the objective of the treatment is to, first of all, get the relief of, there is no more dandruff, get the relief of it. The second objective of the treatment is to rebalance our microbiome and to reduce relapses, right? How can we help them with Dercos anti-dandruff, in your opinion? An anti-dandruff product, shampoo, what it should has inside is, if I want to treat this, make it easier. If I want to rebalance the microbiome, so it has
something to kill the fungal or the main cause of the dandruff.
Okay, so I need to rebalance the fungus. What about the dandruff itself? I can see the white flakes, so I need something to
Keratolysis to remove the flakes.
Yes, exfoliate. Exactly. I need to rebalance the sebum and reduce inflammation. So rebalance and reducing inflammation, the best solution, antioxidants with ceramide. Ceramide R, specific ceramide. So I'm reducing inflammation, I'm repairing the scalp, rebalancing the microbiome, and exfoliating. So Dercos DS anti-dandruff, it has selenium disulfide, that's why the color is yellow. So selenium disulfide, it rebalances the level of fungus and the microbiome, so it will return back to its normal level. We have salicylic acid that exfoliate the skin. Vitamin E and ceramide are in order to have as antioxidant, reducing inflammation and rebalancing the sebum. Okay, but I need data. I need to prove this. You need to see results, correct? As per the consensus, you know the consensus, what are consensus? Usually, like doctors, they set guidelines. You hear about the European guidelines of cardiology recommend you to use this hypertension as a first-line treatment. When it comes to dermocosmetics, we have consensus where a group of doctors from all over the world, they meet and they set treatment guidelines. When it comes to monotherapy as single treatment or adjunctive therapy. Okay, لأنه in specific severe cases, we need medications, correct? So here, where our role as dermocosmetic as adjunctive. So what did they say? They recommended Dercos anti-dandruff when it comes to monotherapy and adjunctive therapy. Both monotherapy if it is mild to moderate case, so you will use it 2 to 3 times a week. But when it comes to adjunctive therapy, and in specific if you are using antifungal shampoos or corticosteroids, يعني if I'm using ketoconazole or any corticosteroid, it is recommended and advised to add Dercos DS. And why it is recommended to add as adjunctive? Because I need my client to be compliant on the treatment. I need better result. Always keep this in mind. You need better results. So whenever I stop the ketoconazole, there is no relapses. My hair is not that dry. So I'm improving the result. And to prove this, a study has been done, ketoconazole 2% versus Dercos DS. You can see here there is no superiority of ketoconazole on Dercos. We are as effective as, but what's important is the compliance and the hydration. 82% are more, the skin reported that the hair is more hydrated versus keto. And 95% are compliant. They continued the treatment for 8 weeks. You know that you apply Dercos DS 2 minutes, whereas ketoconazole, I have to stay in the bath for 5 minutes, just standing, waiting it to be effective, to work. So which one you think your client will be more compliant? Dercos. But always keep on in your mind, whenever it is a severe case and you see a prescription, we keep it, but what we recommend and we advise is to add on to make your client more compliant and for better result. What about relapses? And this is the most also important thing. When it comes to Dercos DS, it's 3 times less relapses than the initial treatment. And what's the most important thing? I need to feel comfortable. I need immediate relief. So from one single application of Dercos DS, you can see immediate 100% elimination of dandruff. This is proven by data, by studies. Otherwise, it wasn't, the doctors and consensus wouldn't recommend it as a monotherapy and adjunctive therapy. It comes as greasy for oily or dry skin and for sensitive skin as well, scalp. The second thing that is related to dandruff, and you said it, is hair loss. So we have dandruff and we have hair loss. Sometimes they come together, sometimes no, I'm suffering just from hair loss or dandruff alone. So when it comes to hair loss, my dream is to wake up and I don't have hair loss. My hair is always full. We'll go to recommendation of shampoo, vitamins, minoxidil maybe. I will answer if you will not answer. Huh?
Minoxidil, I think it's the first line treatment that's all people now, they asking for it or
asking for it.
Know about it.
Or they know about it. And always the objective here, whenever it comes to dermocosmetics, we need to give solutions to reduce and minimize side effects. When it comes to monotherapy, when it comes to adjunctive therapy, here our role to play. Okay? So in hair loss, if we look at the hair here, you see that it has 2 problems. Okay? Outside the bulb and inside the bulb. Outside the bulb, we have collagen. What's the property of collagen? Elasticity. So whenever the collagen is degraded or broken, the hair will lose its elasticity. So it will fall down. So this one problem to think about and to tackle. And the other problem is inside the hair bulb. I need the circulation, if I can say, the circulation inside and the nutrients inside the hair to be there. Here where it comes to a specific enzyme, we call it a specific, let's say enzyme HIF1, it is deactivated. Whenever it is deactivated, there is no new hair, okay, no baby hair. So I need to tackle these 2 problems. How can I help them? With Vichy Dercos solutions, they introduced to the market Dercos region. It is aminexil, 1.5% of aminexil, with the ginger and niacinamide. So aminexil, it will work outside the hair bulb in order to prevent hair loss or decrease hair loss. And inside we have niacinamide and gingerol in order to activate HIF1. So we have a new baby hair. This is a new solution to be launched at Bourgil. So you'll start to see it in the pharmacy, hopefully soon. But this one, as per the study, and you will see a lot of clients asking you that we need this serum that increases hair 14,000 of hair within 12 weeks. It is region. Just keep in your mind we are tackling two problems. The hair loss, so we are decreasing hair loss, and we are working on having new baby hair, okay? Plus, definitely you have the shampoo, the energizing one. Together, once we are talking about monotherapy for 3 months, and once we talk about what? Adjunctive therapy, because today what we are learning something, adjunctive therapy, it's important. Whatever they are taking, you can always add the energizing shampoo. In the attack phase, in the maintenance phase, you recommend to them whenever they stop the treatment to use the energizing shampoo with the region. The shampoo, you use it 2 to 3 times a week. The region, the solution, you use it 5 to 7 times a week, once either on wet or dry hair. Okay? Voila. That's all. Any questions when it comes to hair loss? Does it make sense what I said to you today? Will you be able to advise your client when it comes to adjunctive therapy, to add on prescriptions that you receive? You cannot apply them on the top of each other. There's no like data that will say, yes, apply them on top of each other. It's better to give the time for DS to work because you have to leave it 2 minutes. So you will stay 2 minutes leaving the shampoo and then you will wash, and then you will apply. It's 2 minutes, it's time consuming. It's not like patients want practical. So you can advise them, use the energizing one day, the other day, the anti-dandruff. Okay? Sometimes they will tell you, I don't want to use shampoo. I will not wash my my hair every single day. You will tell them, use the anti-dandruff because it's very important to treat the dandruff, and the booster at night. And the booster, they will use the solution whenever it's available. Yeah. Okay. Any other questions? We have the ampoules that has, no, this one is the solution. It's a booster. So it comes like that. This is the booster. It has a dropper, and it is more advanced than the ampoules. So you have the ampoules, and you have a booster. You can go to both. Sometimes they choose one. They will go to the booster. It's the same as you have a cream and serum, face cream or face serum. Either you go to the cream or the serum. Any other questions? Any other comments? We don't rewash. No, it's a leave-on. You apply it and massage for like 1 minute, and then خلاص, you shower the second day. Yes, wash it properly. Like tell them to wash it very properly. If you want, you can recommend any mineral soft shampoo after the energizing. You recommend whatever any other serums that you have or any other conditioner. Always give extra advice to your client. Like, I want to recommend for you this specific serum that has, like any other serum, that has 1, 2, 3.